Hello friends, my name is Dr.Muskaan Chhabra and I'm working as consultant IVF at Birla Fertility IVF, Lajpat Nagar, New Delhi. So today we will talk about a very important topic, Hysterosalpingography or HSG test. HSG टेस्ट क्या होता है, इसे कैसे करते हैं और इसकी क्या नीड होती है फर्टिलिटी टेस्टिंग में, इसके बारे में आज हम बात करेंगे. Many times when you go to see your fertility specialist, she will tell you that you require an HSG test to test the tubes. अगर हम HSG टेस्ट के बारे में बात करना चाहते हैं तो उसके लिए हमें सबसे पहले ये समझना पड़ेगा कि नॉर्मल कंसेप्शन या गर्भधारण जिसको बोलते हैं हमारी बॉडी में, वो कैसे होता है. जो नॉर्मल फीमेल रिप्रोडक्टिव सिस्टम है, इट कंसिस्ट ऑफ ओवरीज जो कि हमारे अंडाशय हैं, ट्यूब्स, हमारा यूट्रस यानी कि गर्भाशय. ये तीन पार्ट्स जो होते हैं ये मिला के फीमेल रिप्रोडक्टिव सिस्टम को बनाते हैं. So normally at the start of your menstrual cycle, your brain will send some signals to your ovaries in the form of some hormones such as FSH and LH. And the work of these hormones is कि एक egg जो है वो dominant हो और वो बढ़े, and over the next 14 days of your menstrual cycle एक egg आपकी body में grow होता है. The follicle जो ओवरी में बन रहा है ये रप्चर होके इस एग को रिलीज करता है. ये जो एग रिलीज होता है, दिस इज पिक्ड अप बाय द ट्यूब, एंड ट्यूब के अंदर छोटे छोटे माइक्रो मूवमेंट्स की हेल्प से दिस विल मीट द स्पर्म एंड फॉर्म एन एम्ब्रियो और अ स्मॉल बेबी विच विल गो एंड अटैच इटसेल्फ टू द लाइनिंग इनसाइड द uterus. So this is how a normal pregnancy will take place in simplified terms, right? Now अगर suppose इन तीनों ही चीज़ों में से किसी भी जगह पे प्रॉब्लम आती है, चाहे it is at the level of the ovaries or at the level of the tubes or the uterus, हमारी conceiving में issue आ सकता है. So when we talk about HSG test, what do we check? HSG का full form होता है Hysterosalpingography. Hystero मतलब uterus, salpingo मतलब tube and graphy का मतलब उसको देखना. So इस टेस्ट के अंदर with the help of a contrast medium हम tubes और uterus को analyze करते हैं. हिस्टेरोसाल्पिंगोग्राफी की क्या रिक्वायरमेंट है, क्या नीड है? यूजुअली ओवरीज और यूट्रस का असेसमेंट इजीली अल्ट्रासाउंड के माध्यम से हो जाता है, लेकिन ट्यूब्स को देखने के लिए वी नीड टू फिल द ट्यूब्स विद अ कॉन्ट्रास्ट मीडियम और सेलाइन एंड देन विजुअलाइज कि वो ट्यूब्स ओपन हैं या क्लोज्ड हैं. सो टू सी दैट वी कैन डू एन HSG और वी कैन डू अ saline sonography and go ahead and see कि इन ट्यूब्स में से ये contrast medium या ये water whether it is going out freely or not. Because if the tubes are blocked, the egg will not get picked up by the tubes and the embryo will not form because the eggs and the sperm will not be able to meet. So what will happen? What to expect before your HSG test? Is it painful? What happens after the test? So HSG test के लिए usually आपको morning में without you can eat something, you can have a light breakfast and you can go to the hospital. Here in the hospital what will happen is that you will be asked to write a consent, give your consent for the procedure because a dye is used during the process of HSG. Very few people in the population can sometimes have an allergy to this dye. Also, the consent form mentions ki what is the procedure, what are the common side effects of the procedure, and what will happen during the procedure. इसके बाद you are asked to lie down on a table and a small cannula or a catheter is passed through the mouth of the uterus, which is known as the cervix. The reason why we are passing this catheter is to reach the uterine cavity. Now with the help of a contrast medium, हम एक syringe लेके contrast medium से fill करते हैं और इस catheter के अंदर gently उसको push करते हैं. When we hold your cervix to push this dye, a sense of stretch or discomfort can happen, but this is usually well tolerated by most patients. So please don't be fearful of HSG test, that it will be extremely painful, that you will not be able to tolerate it. Usually this is not the case. However, हर patient की pain tolerance different होती है, and in a few very anxious patients or in patients in which pain tolerance is very less, sometimes we can give sedation or anesthesia to make this process more bearable for you. ये contrast medium पहले uterine cavity को distend करता है और उसके बाद both tubes के अंदर जाता है और tubes से बाहर निकल के फिर आपकी पेरिटोनियम में फैल जाता है या फिर आपकी टमी में जाता है. दिस होल प्रोसेस जो है ये हम विद द हेल्प ऑफ एन एक्सरे डॉक्यूमेंट करते हैं और इसकी पिक्चर्स लेते हैं. एंड दिस will complete our hysterosalpingography test, because the movement of this contrast from the mouth of the uterus to the uterus will outline the cavity of the uterus, will outline the tubes, and it will tell us whether it is open or not. And usually after a brief 15 minutes or 20 minutes of rest, you can easily go back home and you're feeling normal and you're feeling absolutely okay. In case this test has to be done under anesthesia, then obviously you have to come fasting for this test, and after a brief interval of getting up after anesthesia, you can go back home the very same day. So there are some conditions in which you must avoid doing an HSG test. For example, we prefer doing this test in the first half of the menstrual cycle, preferably around day 6 to day 8 of the menstrual cycle, because we know for sure that during that time no unintended pregnancy would have occurred, right? Also, if there is any suspicion of pregnancy, we have to avoid the HSG test. Any suspicion of an active infection, tuberculosis, we have to avoid this test. And if you have any suspicion that you may have a drug allergy or allergy to dyes, you have to tell your doctor about it so that they can decide whether you're fit to take the HSG test or not. Overall, this is the gold standard for testing your tubes, superseded only by diagnostic laparoscopy, and very well accepted by most patients, and can be easily done in a single day, and can give us a very good amount of information about your uterus as well as your tubes.